Hi, this is Jay at IFAST University, and today I'm going to recap for you the 3 Intern TED Talks that we had today. The Intern TED Talks are a final project at the end of our internship, and we ask that the interns put together a 10 to 15 minute presentation on a topic of their choosing. So it's supposed to be something that they're passionate about, something that they can talk knowledgeably about and entertain and inform us. And so it doesn't even have to do anything with strength and conditioning necessarily. It can be about anything of your choosing. And this group of interns really hit it out of the park, and they were a fantastic bunch of interns in general. They worked really hard all semester. They were very inquisitive and very curious, and asked great questions all the time, and really pushed us to become better coaches because they had great questions for us to answer, and or at least explore together if we couldn't answer them. So the 3 interns this semester, Allison, Cory, and Casey, thank you so much for all your hard work. And this is your recap. So the first intern to go was Allison, and she talked about a personal journey that she's had over the last few years, struggling with Lyme disease, or maybe not Lyme disease. Basically, the story was that she has been misdiagnosed, treated for diseases that she didn't have sometimes as a result of several factors. One, at some points an insurance system in America that doesn't allow physicians to practice the way that they need to sometimes because they won't pay for certain treatments or they won't pay for certain diagnostic tests. And so that was a extremely frustrating story to listen to, because it's so heart-wrenching when you hear about somebody who's gone through the medical system that's really failed them, and I'm sure most of us have a friend or a family member, or maybe we've gone through it ourselves, where we've had a similar experience, like kind of a nightmare scenario where you go to doctor after doctor, you fight with insurance companies, and you're just not getting the answers that you want. And the other part of her talk was about how the medical system is not set up often to allow doctors, or it doesn't even teach them or train them to dig deep for underlying causes sometimes. A lot of times physicians are trained to identify symptoms and prescribe medications to address those symptoms, but they're not given opportunities, and they're not even trained really to dig deep and look at all the way intricate factors that can affect your health and try to arrive at a diagnosis of the root cause rather than just symptoms. And so Allison has struggled with being diagnosed with everything from strep throat to MS to Lyme disease, and a lot of those diagnoses were incorrect, and she's had a terrific struggle with that, and so she really brought a lot of passion and a little bit of anger in talking about how the system is not conducive to treating people very, very well in terms of getting to the root cause of things. So number 2 was Cory, and he talked about, what did he talk about? He talked about chaos and complexity. So he was a math major, and so he talked about complexity at a level that I struggle to understand. But the really cool part of his talk was when he tied together a view of complexity theory or chaos theory and a view of flow. So I can't recap the details for you because I frankly didn't understand them, but basically he talked about how you can look at the way that your heart rate or other measurements in your body can be measured at a macro level or a micro level, and if, like fractals, the macro and the micro should resemble each other to some extent, and the degree of similarity in the measurements can tell you something about the adaptability or relative non-adaptability of that individual. I think I'm getting those details right. Cory, maybe you can chime in the comments if I'm getting it wrong. So basically you want certain measurements to be somewhat similar, but not too similar, because if they're not similar at all, that means your system is completely erratic. And if they're too similar, it actually means that your system is too rigid. So you want a measurement that falls somewhere in the middle, in that range of completely monotonous versus completely chaotic. And so you want something that's somewhat similar but not too similar all the time. So then he tied that back to flow, which is, in a flow state, you're basically chasing some kind of performance, like whether you're playing a musical instrument, or you're on the football field, or you're rock climbing, or you're playing chess, or whatever it is. you're going to enter a flow state only if you are doing something that is right in the sweet spot of your performance. So something that is difficult enough to challenge you so that it's not too boring and monotonous, and something that's not too difficult, because if it's too difficult, then everything falls apart. And so somehow he tied these two concepts together, chaos theory and flow, and I'd never seen that done before, and that was a really nice way to tie in two seemingly disparate concepts. And number 3 was Casey, and Casey talked about sabermetrics and advanced statistical analysis of sports, especially baseball, and also football and soccer and basketball. And he made several points, but his overarching theme was that sabermetrics seem counterintuitive. They're kind of the image that we have of sabermetrics is like, some kind of geek in his mom's basement typing away furiously and doing some analysis of these statistics that we can't understand. But he outlined for us several aspects of how sabermetrics work, and so I'm gonna just highlight a couple of them for you. One was about how sample size, right? So you need a large enough sample size to be able to make good projections based on your data. And so if I make 5 3-point shots, if I attempt 5 3-point shots, and I make 4 of them, I'm going to have an 80% 3-point field goal percentage, but that's really meaningless. And in fact, Casey pointed out that 3-point percentages aren't actually a good indicator over the course of a single season, because even with hundreds of attempts, that's not enough data to give you a true sense of where that athlete is performing. And so you actually need 3 or 4 seasons worth for most athletes to determine what their true performance is. And it probably is even more complex than that, because you have to be able to dissect at some level whether the athlete that's making those shots is a good 3-point shooter who's being hit with some poor shooting opportunities, or a mediocre shooter who's being blessed with a lot of good opportunities, for example. And so you need a lot of data points for the noise to kind of cancel each other out, and you also need context and context and context.